Hello, and thank you for joining us this morning. It's a great day in Calgary. I want to acknowledge that we are gathered on the traditional territories of the signatories of Treaty 7, and I acknowledge the Métis people who share a deep connection with this land. My name is Diana Batten, and I am the Alberta NDP candidate for Calgary-Acadia. I am joined here today by Iman Ali, an international medical graduate, and her husband, as well, Ghazi, who is an international medical graduate as well. And of course, our incredible leader of the Alberta NDP, Rachel Notley. As a registered nurse, I can speak firsthand to the destructive impact the UCP has had on our healthcare system. I am running in this election because I believe Albertans deserve better healthcare. And I believe that all workers deserve to work in a supportive environment where they are respected for their talents and their expertise. I know that if we don't act quickly, we will continue losing more of my colleagues as they continue to feel they have no other option but to leave this province or retire early. We need reinforcements. I'd like to invite Iman Ali to share her story.
Thank you, Diana. My name is Iman Ali, and I graduated as a doctor in Egypt in 2008, and I became a pediatrician in 2016. I moved to Canada in 2020 with my husband and children through a skilled worker stream because Canada needs more doctors. I chose Alberta specifically because I was told I had a clear process for internationally trained doctors to practice medicine. I have completed the necessary exams, but I need recent experience to qualify to work as a doctor. However, there are not many opportunities for internationally trained doctors to work in healthcare setting that also meet requirement of recent experience. So now I am being told that my best path forward to be recognized as a doctor in Canada is to go back to Egypt or a different country where I meet their qualification to get the recent experience I need before I can work here. If I or others in my situation leave Canada to get this experience, it's still not guaranteed that there will be a job for us to come back for. And many of us question if it's worth trying or continuing to try to become a doctors here. Alberta needs more doctors and healthcare workers now. 800,000 Albertans don't have a family doctor, and so many internationally trained medical graduates are ready to help. Alberta doesn't have a shortage of doctors, we have a shortage of licensure. We have so much to offer. I choose Canada to be my home because it's an accepting place. I am welcomed here, my children love their school, and my husband, who is a pharmacist, was able to start working as soon as he completed his assessment. I don't want to leave my husband and children to practice medicine in a different country, just to have a chance of practicing in Canada sometime in the future. I want to use my skills and talent to help people here to provide the care that they need. Currently, I am told that I don't have the qualification to work in healthcare. When I first came to Canada, I couldn't find other jobs, such as in Tim Hortons or Mac, to help pay our bills. I am told I'm overqualified. I'm glad that the Alberta NDP is committed to increasing the residency spaces for internationally trained doctors and funding more positions to work in healthcare. Understand that every country recognizes qualifications differently and that people who train elsewhere need to take certain steps to work in their field in new countries. But there should be a clear path on what these steps are and more opportunities to complete them. Thank you.
Thank you so much, Iman. Albertans need you, and Alberta needs to make the process for you easier. I've had the opportunity to teach internationally trained nurses, and I know the important contributions they make to our classrooms and for our patients. Now I'll turn it over to Rachel Notley.
Well, thank you. Thank you very much, and thank you both for being here. You know, the first step to ending the crisis in healthcare is electing a new government, a better government, a government that will treat doctors and nurses and all other healthcare professionals with respect. And to the doctors, nurses, and all healthcare professionals supporting our families across Alberta, thank you. You know, this week is actually National Nursing Week. This year's theme is Our Nurses, Our Future. And the future is what we're here to talk about today, a better future. Because under the UCP, the past 4 years have been very, very difficult. The UCP picked fights and chased away doctors and nurses. And this really has exacerbated the crisis in healthcare here in Alberta, worse than what we see in other parts of the country. Parents and their kids are waiting 15 hours for care in the children's ER. Albertans are waiting for ambulances and waiting for surgeries and, of course, waiting for a family doctor. So enough is enough. Today we're here to roll out a robust plan to better recruit healthcare professionals, train them here, and keep them here. There are several components to this plan. The first step is we're going to be offering signing bonuses of up to $10,000 to bring qualified and desperately needed health professionals here to Alberta. We'll budget $70 million per year for this critical short-term measure to keep our hospitals open and ensure Albertans in need of care are getting it. Second, we need to do more to help people like Iman get the training that they need faster and to be supported while they're doing it. So that's why we're going to develop a program to support or supplement the income of foreign-trained health professionals who are taking classes to upgrade their credentials as a condition of their licensing. In doing this, we can ensure that those kinds of folks and so many others are able to focus more clearly on their studies and get out into their professional field faster. Third, we're going to put in places more training and practicum opportunities for people just like Iman to get the work experience they need, to both earn money and obtain that recent experience that is required to meet those licensing requirements. And finally, we'll take the longer-term steps needed to ensure we're training the necessary healthcare staff for future generations by adding up to 10,000 more post-secondary spaces in Alberta's schools for doctors, nurses, and other allied health professionals. And this will be for a wide range of health programs that can take anywhere from 1 year to 4 years or considerably more when looking at physicians. We'll invest $375 million over 3 years to add these spaces so that folks who want to pursue these careers are not forced to leave Alberta in search of that important healthcare education. This strategy is ambitious, but it's also critical to our future. It takes political will from a stable, competent, and trusted government to truly end the crisis in healthcare. You know, last night we saw wait times of 15 hours at the South Health Campus and nearly 13 hours at the Peter Lougheed. Today, I come before Albertans with an ambitious plan to make this stop. Now, Danielle Smith and the UCP will say this can't be done, but that's because they just don't have the determination. What they do have is a plan to sell off our hospitals to corporations, but what we have is a plan to staff them. We have a lot of work to do, but we can accomplish it together. We can fix healthcare, we can bring doctors back, we can support our nurses, we can build a better future for all Albertans. So I'm happy to take any questions you might have, as are, of course, our two wonderful guests today.
We'll start here with questions in the room before we go to Zoom and on the phone. If you're on Zoom, please push the raise hand button. If you're on the phone, push *9. Reminder to unmute yourselves there and introduce yourself by name and outlet. And here in the room, if you could do the same. We'll start with Tim.
Thanks, Tim Brooks, CTV. Let's just ignore for a second what your party says about Danielle Smith privatizing Alberta's healthcare. I just want to know what makes this specific plan better than not only the UCP's proposal, but also other provincial proposals, because everyone's scrambling for healthcare workers right now.
It is true that everyone's scrambling. Let me start by saying probably the most important component, well, not the most, but one important component of this proposal is that Alberta's NDP is committed to restoring a trusting relationship with all healthcare professionals. With the UCP, we've got a government that ripped up the doctor's contract right after they got elected, threatened to fire thousands and thousands of frontline healthcare professionals, and very recently referred to physicians as Nazi sympathizers. So with that setting, it is hard to imagine Alberta succeeding in a recruitment campaign in competition with other provinces. Now, what we're doing here, which is also more ambitious, is that we are, of course, going to add more spaces, which will allow us to train more folks who are right here in Alberta, and ensure that in the longer term, those folks are here. In terms of streamlining and supporting internationally trained graduates, I think that we're the only ones that are actually offering that opportunity of income support to allow them to accelerate the credentialing that they're talking about, and or that the regulatory groups are asking for. And then, of course, what we're also proposing, which is a bit different, is this accelerated, or this pathway to work experience. And then the UCP have suggested adding spaces, but they're not suggesting adding anywhere nearly as many spaces. So all of that together, I think, will ensure that we're more successful at recruiting and retaining. And then, of course, I haven't heard from the UCP any proposals with respect to the signing bonuses that are part of this announcement, which, of course, allows us to compete with a couple of other provinces that have already moved to that strategy.
Thanks. And then switching gears, new polling out this morning shows some gains for your party. I'm just wondering, looking at these polls, does it change your strategy at all? And what do you kind of, I guess, credit some of the polling success to this far in the campaign?
Well, you know, listen, when it comes to horse race polls, there are good polls, there are bad polls, they will change, and you know, it's trite, but it's really true. The only poll that matters is the one that people participate in on election day. But what I will say is this, is that Albertans are telling us that what they want to hear about from their leaders is how they're going to address the healthcare crisis. How they're going to deliver trusted, competent, capable leadership that will provide stability to a province after years and years of chaos, and what we're going to do to address really bread and butter affordability issues. And so those are the things that we've been talking to Albertans about very consistently, not only for the last 2.5 weeks, but for several months and more. And we'll continue to do that because it's what Albertans are telling us is their priority.
Any other questions here in the room? Seeing none on the phone or on Zoom. Thanks very much, everyone.
Thank you so much for coming.